Hello, class. My apologies for not getting the lecture up yesterday. I have a lot going on and family health issues, running to appointments. I know a lot of you can relate to that because everybody has so much stuff going on this semester. It's unbelievable. But anyway, I'm going to just show you some illustrations of the skeletal system, and then we're going to actually look at bone pictures. Okay, so the pictures are already up on the discussion board. As you know, the pre-assignment was pretty lengthy, so I want you to go through these things. I'm going to post a lecture after this, but I want you to get a good handle on the anatomy for bone and muscle because it's going to be a lot. And you got to spend time with it. That is the thing. I can go over it and over it, but anatomy requires a lot of time. And so now we're getting into a little bit more heavy anatomy than we have had before. So it's going to require some time, as you can see from the pre-assignment. So I'm going to turn me off, and we're going to start here. So this is an articulated skeleton, or a skeleton in articulation, which means the bones are in place like they normally would be. And so we have two parts to the skeleton. We have what's referred to as the axial skeleton and the appendicular skeleton. So the axial skeleton is all of this part. Okay, the head, neck, and the torso. So this is the vertebral column. This is axial skeleton. And then the appendicular skeleton makes up the appendages, right? So this is the appendicular skeleton. Okay. So on this picture, we're just going to tackle um, the bones in general, and then we will look at the bones more specifically in a minute. So I'm going to zoom up and kind of do half at a time so you can have a better look at this. Okay, so of course we have the bones of the skull, and there are a number of sets of bones, the cranium and the facial bones. So the bones of the head here are cranial bones, and then you have the facial bones. And this picture is very crude. It doesn't give you, um, an overall view of all of them. So let's put some of these in. So I will start here. This is the frontal bone. Again, if you need to make this bigger, hit that little thing on the corner with the 4 arrows pointing out. And so that's the frontal bone. This bone that makes up the bulk of the face is the maxilla. Then the jaw is the mandible. Notice I am saying bone along with the name because um, there'll be muscles that correspond with this as well. So you need to differentiate them. This is the parietal bone. Temporal bone. Occipital bone. Okay. And we're just going to go down the line here. So this is the sternum. Well, first, let's look at this way. This whole thing is the sternum. But you see there are 3 arrows pointing to it, one here, and then one down here. So each of those things is something different. So we're going to name them each. Okay, so this is called the manubrium. This is the body of the sternum. And this is called the xiphoid process. Okay. Let's go on this side here. This is the clavicle. This is the scapula. And the clavicle and the scapula together create what's referred to as the pectoral girdle. Okay. This is the humerus. Okay. This is the vertebral column. Now, we have not, this picture doesn't distinguish the different parts. All that is vertebral column. So this arrow right here, I'm just going to say vertebral column because I don't have arrows on each part. So it's not asking me to distinguish each part. So I'm just going to put vertebral column here. Let's go back over here. So these are ribs. This also is not asking me to distinguish the types of ribs. So, because I only got one arrow on ribs. So I'm just going to put ribs. And we'll come back and distinguish the types. Okay. So take a minute and look at that. And then I'm going to scroll down so we can see more of the picture. Okay. So these pelvic bones are actually made of 3 bones in combination together. And let me draw a picture here. So this whole thing looks like one bone, but it's actually 3 bones together. And I have a marking on all 3 bones. So one here, and one here. Okay. So all 3 of them together is called the oscoxy, and then I will name each of the 3. Okay. So let's try not to erase any other thing. Okay. So this is the ilium. This is the ischium. And this is the pubis. And collectively, they make the oscoxy. Okay. This is the sacrum. And the sacrum and the oscoxy together make up the pelvic girdle. Okay. Let's go over here, back up to the arm. We have the radius. And we have the ulna. So the radius is on the thumb side and the ulna is on the pinky side. Okay. Let's go down to the wrist. These are carpals. And then the fingers, the fingers are over here, but the bones in the palm of the hand, those are called metacarpals. And then the fingers are called phalanges. Okay. Let's go back up. Okay, so this bone right here, this long bone that's making up your thigh is the femur. And the femur sits in this socket. Let me turn my pencil on. So you see this socket right here that the femur sits in? That socket is called the acetabulum. And so the part of the femur that sits in the acetabulum is the head of the femur, and that's what the arrow is on here. Okay. Give you a minute to look at that, and we'll move it down. Okay, so the kneecap, that is the patella. And then the bigger bone in the lower leg is called the tibia. And the skinnier bone in the lower leg is called the fibula. Now, I do not take off a spelling unless your spelling is just beyond my understanding. But be careful not to say tibula and fibia because that's wrong. So it's tibia, which is this big one, and it's kind of T-shaped. Tibia. And then the fibula is this long, skinny one on the side. Okay. And then the bones making up the ankles, and I won't try to distinguish anything on this particular picture. These are the tarsals, and these are tarsals as well. These two arrows over here are pointing out specific ones, but I'm just lumping them all together. Okay. And then we got metatarsals down here making up the rest of the foot. And then for the toes, those are phalanges as well. Okay. I'm going to zoom back out. And of course, you can always zoom in and look at those. Let's look at another one. From different views, I'm going to zoom in on this one like we did the other. Okay, so we're on the posterior side here. This is still parietal bone here. This back here is an occipital bone. And then the first two vertebrae here are C1 and C2. This. They also have names atlas and axis. So you need to know both of those names. Now, for the other vertebrae, you don't need to know the names of them. You just need to know the categories. Okay. And so I'm just going to put a little bracket here. All right. So these are all cervical vertebrae. Now, this is pointing to a number of different things, but all of these are thoracic vertebrae. So I'm going to couple these together. I'm not sure if they're trying to talk about the body of the vertebrae versus the spine of the vertebrae, but this is not a good picture for that. So we're just going to name these thoracic vertebrae. They articulate. Articulate means touch. They're, in this case, they're going to articulate with the ribs. Okay, let's go back to this side over here. We had not talked about this particular bone. This is where the cheek is, right? So we talked about that. That's temporal bone. We talked about the mandible. But where this cheek is, that's called the zygomatic bone. All right, so that's right here. Let's put that in. Mandible again here. Then we have the clavicle. We're looking from the posterior. And this is the scapula. And so you get a good view of the scapula here. This is actually having you name some parts of it. I don't know if it's clear enough to name the parts, but we'll name them anyway. So we'll just say scapula for 30. And then if you look at the scapula, you'll see that there is this process running across it, right? Off the back of it. That's the spine, and then it ends in a large process. That's called the acromion. So let's put those in. This is the spine of the scapula. And then this is the acromion. Okay. Okay. This one delineates the different ribs. So we have 12 pair of ribs or 24 ribs, and we have the first 7 are called true ribs, and so 29 will be true ribs. Okay. And then the last 5 are called false ribs because they don't directly touch the sternum. And the last 2 of those, which are these 2 over here, are called floating ribs because they don't touch the sternum at all. Okay. So these first 7 pair, these are true ribs. And then the last 5 are false ribs, and the last 2 of those are floating. Okay. Let's see. We can see the humerus over here. Label that. Okay, take a look at that, and I'm going to move this down. Okay. So now here, number 27, we delineate thoracic vertebrae? We did. So then down here, we got lumbar vertebrae. So we'll put that for 27. Okay. Over here, got the ulna. And if you ever want to question how do you know which one is which, again, the ulna is on the pinky side, the radius is on the thumb side, and the ulna has this process that makes the point of the elbow. It's called the olecranon. And we'll look at that more when we actually look at the bone. So that's the ulna, and then this one is the radius. These are carpals that this one is pointing to. Okay, let's see. Okay, so this whole thing again is the os cocci. Right. So that's what I'm just going to say for that. So SAE is plural. Then we got the sacrum. Then we got the coccyx. Okay, and the sacrum and the coccyx are fused bones. Okay, take a look at that, and then we'll move it down. I'm not going to label the, I guess that's, I don't know what number that is, but the one under coccyx, I'm not going to label that. I think they want pubis and ischium here, but I don't. You're not going to view the pubis from the posterior side, so I'll label the ischium, but we'll always label the pubis from the anterior side. Okay. So this is the ischium. Femur. Okay. 22. Let me move this over a bit. 22. Those are the metacarpals. 21 are phalanges. Okay. On the femur here, they're asking you some specific things on the back of the femur. I won't ask you on a picture like this. Okay. Let's go down. Tibia. This is from the posterior side again. Tibula. And then 15 and 16, those are going to be carpals. We can't see the other things from this side. So I'm just going to put carpals back here. Tarsals. I don't know why I said that. Carpals at the wrist. Okay. Let's zoom out. And so this is the same things from the side view. Okay. And then over here, you can see the tarsals, the metatarsals, and then the phalanges at the toes. Okay. Now let's look at some actual bones not in articulation. So in this articulation. Okay. What bone do you think this is? So you have to look at the characteristics of the bones. Okay, so this obviously is a long bone. It has this rounded part. The rounded part is always a head, so it has that. And the head is always proximal, closest to the point of attachment. It has some other little protrusions on it. What might these be? Okay, so we'll take a look at that. So the bone is the humerus. I'm going to put some lines on here for things we're going to identify. I don't think I have you identify that other protrusion, so I won't do it here. But this bone is the humerus. Okay, so this is the humerus, and then this is the head of the humerus. This is the lesser tubercle. This is the greater tubercle. Down here, you got these little divots. One is a rounded edge, and the other one is a depressed edge. The rounded edge is called the capitulum, and the depressed edge is called the trochlear. Okay. Let's zoom in. Okay, so this is the head. Lesser trochanter is a smaller protrusion, and greater tubercle trochanters are on the femur. Lesser tubercle and greater tubercle. So lesser means smaller, greater means bigger. Let's move down. And so it's hard to really appreciate it on this picture, but this is rounded and smooth, and that's the capitulum. And then you can see the depression here, kind of like a spool. That's the trochlea. Okay. Okay, let's go to the next picture. Okay, this is the ulna. Put some lines on here. Oh, we can't see a good view of that, but let's put that name on here. And then we'll zoom in after we get it all labeled. The ulna. And there are three main parts up here. I guess I'll put a line up here. You can really see it best from the posterior side. That's the thing that makes the point of your elbow. That's the olecranon. Then you have the trochlear notch. So that trochlea from the humerus sits in this notch. And then we have the coronoid process. So this is the head of the ulna. I really don't make you know the head of the ulna. But also down here, you can't see it. There is going to be a pointy part down here. And that pointy part down here is going to be the styloid process. So you'll see styloid process a few times. Pointy parts are often named styloid process. So let's zoom in. So this is not a good representation because I like to point to it on the back, but this knot here that makes the point of your elbow across the back here, that's the olecranon. Then this depression is the trochlear notch, and then this protrusion here is the coronoid process. And then you have the head of the ulna, and then there's a pointy part here on the other side that you can't see. That's the styloid process. Okay. Okay, this is the other side. So this is the olecranon process, and this is the side I like to show it on. Okay. And so that knob sticking off the back here. And then we go down and you see that little point down here? That's what is the styloid process. Okay. Let's zoom back out. So we got the olecranon process, which is the knot on the back, and the styloid process, which is this point at the bottom. Okay. Again, hit those 4 arrows out if you need to zoom in. Okay. Okay, this is the scapula. This is the scapula. And this is from the underside. So this part, the smooth part of the scapula, is lying against the body. So let's put that in. So the smooth part is called the body of the scapula. Okay, there's a slight depression here. The head of the humerus sits in this depression. It's a really slight depression there. That is called the glenoid cavity. Yeah. Okay. And then we have the acromion. Now you can't see the spine because that's on the more posterior side, the part that's facing away from the body. But this is the acromion at the end of that. Okay. And then this right here is another process more towards the body. This is called the coracoid process. Coracoid. So don't mix up coracoid and coronoid. So I'll zoom in a bit so you can see those. So this is the glenoid cavity, this depression here, acromion, coracoid process. Okay. And these bones are in no specific order. Okay. This is the tibia. Let's go back because I did not put the name of the bone on here. So let's make sure I have the name of the bone on each of those pictures. So that's the scapula. Did I put it on this one? This is ulna. And that was ulna, so we had it on there. Okay, just want to make sure. Okay, what bone do you think this is? It is T-shaped, right? So what bone is that? The tibia. Now, there are some bones that you should be able to tell right and left kind of easily. And I'm going to explain that in the lecture. But you need 2 clues. Something that is anterior, posterior, something that is medial or lateral, right? Those are your 2 clues. It's easy to tell what is superior and inferior, or what is, in this case, proximal and distal because it's on the same limb. So this is the tibia. What you need to know is this projection here, and then this down here. These 2 things are going to help you determine whether this is right or left. This one happens to be a right tibia. This is the tibial tuberosity. The tibial tuberosity always points to the front, right? Or anterior. And this down here is called the medial malleolus. So it's always medial. The inner part of the ankle. That little knot on the inner part of your ankle, that's this medial malleolus. Okay. Let's zoom in. That knot, you can palpate that. So if you go to your kneecap and you go down under that, right under the round part of your knee, and a lot of guys in particular, they don't have as much fat as females do a lot of times, and so you can see that protrusion underneath the kneecap. That's the tibial tuberosity, and then that medial malleolus is that knot on the inner part of your ankle. Okay. Okay, this is a humerus. We looked at the humerus before. Let's take it in sections. This picture is not that great, but that's okay. First, let's put humerus here. And then we have the head of the humerus. We saw that before. And this is the greater tubercle. And I probably spelled that different than I did before. I think this is the correct spelling. I'm horrible with spelling, so you always want to check your spelling. Greater tubercle. Yeah, I think that's right. Okay. And then you don't need to name that. Then the part that I want to name here, I'm not worried about condyles, epicondyles here, but there's a depression right here on the posterior side of this humerus. That's called the olecranon fossa. The olecranon fossa. So that olecranon, part of that kind of dips into this depression when you are bending at the elbow joint. So this is the olecranon fossa. Okay, so now when you want to tell a right or a left humerus, then the way you're going to do that is you're going to look for something medial and lateral. So the head always faces medially. So that's this part. Let me get my pencil. So this is the head. That's always going to face medially. And then this olecranon fossa is always going to face towards the back. So this would also be a right humerus. So the head would face medially. So if this is your body here, this is the glenoid cavity. The head faces that. And then this olecranon fossa faces the back or posteriorly. And so those are the clues you would use for that. Okay. Let's see. What's next? Okay, what bone is this? What do you think? This is a radius. And this little flat part is the head of the radius. And then this little knot on the side is the radial tuberosity. And then the point down here is the styloid process of the radius. Let's zoom in. So this flat part is the head of the radius, and then this protrusion on the side is the radial tuberosity. I'm not going to ask you to figure out right and left for this. And then the point down here is the styloid process of the radius. Okay. What do you think this one is? A femur. Okay. So let's put some lines on here. So the first one is the head of the femur. The head of the femur has a depression in it, and we're going to zoom in on it in a minute. That depression is where a short, thick ligament kept this attached in the acetabulum, but once the ligament is gone, there's a depression in the head of the femur here. It's called the fovea capitis. Greater trochanter, lesser trochanter, linea aspera is this ridge going down the middle of the bone here. Now we got these two smooth edges. These are called condyles, and one is lateral and one is medial. So how do we know which one is which? Well, the head is always going to face medially. Right? The head of the femur always faces medially. So the one on the same side as the head is the medial condyle. And the one on the other side then would be the lateral condyle. Okay, so let's zoom in. So you can see the head, and then this is the fovea capitis, that depression in the head. Let's see if we zoom in any more. Can you see that pretty well? You see that? That depression right there. And then this one right here, I don't know if we labeled it, but we can. I got the marker there, but I don't know if I labeled it. This is the neck of the femur. Okay, so that's the neck. And then we had our greater trochanter and our lesser trochanter. And these projections allow for muscle attachment and joint formation. So we'll talk about that part in the lecture. Let's move this down so we can see. Nope, I hadn't labeled the neck. This ridge through the middle here, that's the linea aspera. And then down here are my condyles, these smooth edges. And so the one that's on the same side as the femur is the medial. Same side as the head of the femur is medial, and the one on the other side is lateral. Now, I don't know if I have epicondyles also on your list, but the epicondyles are these little bumps on the sides. You can't see that one, but those are epicondyles. Okay. The condyles are these smooth ridges here, and then the bumps on the sides are the epicondyles. Okay. Okay, this is the pelvic bone or the os coccyx, so we'll put the name up here. Okay, and I'm going to zoom in, and I don't have the list in front of me that I require, a list of things that I require you to know. So let's name the bones first. this depression, opening. I know I have, this depression, and probably this depression. I think I probably have on your list this ridge. Okay. So let's name the bones first, and I'm going to put the bones in another color. Let's put the bones in a purpley color. So this is the ilium. And this is the ischium. And this is the pubis. Okay. Now, we'll go back to a blue color for the others. So this is the iliac. Well, let's do these openings and depressions. So this depression right here, this is where the head of the femur sits. That's called the acetabulum. And this opening here has a nerve running through it, and the nerve has the same name as the opening. So let's name those. So this is the acetabulum. And this is the obturator foramen. Okay. And then we have this iliac crest up here. You can kind of palpate that. So palpate means to actually feel with your hands. So I'm a little bit fat, so it's hard for me to feel mine, but you can feel that iliac crest. That's like where your hip is. Okay. And then this is the greater sciatic notch. There's a nerve that runs across that notch. And then the lesser sciatic notch. Okay. So this ridge up here is the iliac crest. Okay. And then we have the greater and lesser sciatic notch. And these bones have many more processes and depressions than we're going to name. So when you look at the pictures in the book and even your coloring, it's so many more things. It's too much for you to know all of these. Okay. This is the acetabulum. So you need to know the ones that I'm naming here. Acetabulum. This is the obturator foramen. Oh, there's one I didn't label. Let's label it. Or maybe I didn't mark it. Let me move this. So this bone was the ischium. This knot on the back here is called the ischiotuberosity. So let's name that. Okay. And then the bone over here was the pubic bone. Okay. Okay. This is the fibula. I'm not going to require you to know any parts of it. It does have a head at one end, and it has the lateral malleolus on the other end. Okay. but you don't even have to worry about that. If you were holding this in your hand, sometimes it's really hard to delineate these ends, especially on an actual bone because the bone gets worn away. But you have a head, and then you have the lateral malleolus. So that's kind of the knot on the outside of your ankle. Okay, what do you think these bones are? Okay. So if I were to point to anything on here, you should be able to identify them. Now, what I'm going to do is zoom in because this gives you a better picture of some of the processes and depressions than some of the other bones. So here you can see the head of the humerus here. You can see greater tubercle here, lesser tubercle here. You can see, okay, so now remember I said you had this smooth rounded edge, that's the capitulum, and then this depressed part right here, that's the trochlea, that's more anterior, and then you can see this depression right here, that's the olecranon fossa, so that's on the posterior side. And then the ulna, so we have our olecranon, which is the bump on the back, the trochlear notch right here, and then our coronoid process right here. Okay, trochlear notch, olecranon, coronoid process. And then if we follow that down, the point here is our styloid process. This is styloid process of the radius. Let's go back up. In the radius, you can see the flat head here. So that's the head of the radius and the radial tuberosity. Okay. This is the clavicle. This is the clavicle, and this is not the direction it would normally be, but we can point out some parts to it. The parts are just two parts that you need to name: sternal end, acromial end. I'm telling you what it's going to touch or articulate with. Let's zoom in on the picture. So if you look at the sternal end, it actually is more kind of block shaped. And if you look at the acromial end, it's flatter. It's more flat. Okay. 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 So now we're looking at some skulls. And so these are color coded. So what I want you to do is look at the color coded ones first, kind of get acclimated to those, and then we will look at the white ones. Let's see. A lot of lines on here. The connections between the bones of the skull are called sutures. So there are a few that you need to know. I'll come back and label those separately. So this is, we just go around like clockwise. This is the parietal bone. This is the sphenoid bone, and I got a couple of arrows pointing here. You can see the sphenoid from various angles. And so you can see that on this picture, it's red. And so you can see it from a couple of different angles from this view. Okay, now this temporal bone is all orange. Now this process is called the zygomatic process of the temporal bone. Okay. And then this part down here that you can actually palpate that as well. If you reach behind your ear, there's a knot behind your ear. That's what this is. This is called the mastoid process. Okay. This is the lacrimal bone. Mandible. Maxilla. Okay, so this little green, and I'm going to zoom in on these in a minute. The little green down here is called the vomer. That makes up part of the nasal septum. Zygomatic bone. And actually, let me just show you something. So this was the temporal process. The zygomatic process of the temporal bone. This right here is the temporal process of the zygomatic bone. And so they come together and create what we kind of refer to as the cheekbone. The blue over here is my zygomatic bone. Nasal bone. And then in here, this can be seen from a number of different views as well. This is the ethmoid bone. And then you have the frontal bone. Okay. I want to zoom in and look in here. Okay. So if we are looking here and here, that's sphenoid bone. You can see some of that around here. So all of that, and you can see it from the other side as well. When we flip it over, we'll look at that too. That's sphenoid bone. This is ethmoid bone, and we have a couple of different areas where we can see that one as well. This is the lacrimal bone, nasal bone. All of the yellow here is maxilla. This is vomer. You can only see a small part of it. It's an oddly shaped bone. And then you can still see some little pink here. That's part of this bone. Okay. That ethmoid has a couple of different parts too. Okay. Okay. So this is the skull without the color coding. You need to know it on both. So I'm going to name a couple of the sutures that you can see here. Oops, don't want that big arrow. So this one is called the coronal suture. This one is called the squamosal suture. Okay. Now I'm going to label some things. I'm going to put a different color besides the purple. Let's do. You tell me what these are. I'm not going to write on this one. I don't know if I'm going to write on this one. What do you think? Maybe I will. Okay, I'll start up here. This is ethmoid. You always need to say bone, but I'm going to make it shorter by not. This is parietal bone. Sphenoid. Zygomatic. This is that mastoid process. Mandible. Maxilla. Oh, my text box keeps going away. Nasal. Lacrimal. Frontal. Okay. Now, I also want you to notice there are some ridges in here. These bony ridges in here, those are referred to as nasal concha or concha. And we'll see them later when you see the fleshy ridges when you go to the respiratory system. But those are nasal concha. They're created by ethmoid bone partially as well. Nasal concha. Okay. Okay, so this is underneath. Let's zoom in a bit. Okay. So the bone at the back here, this is the occipital bone. And then you have this protrusion on the occipital bone right here. That's called the external occipital protuberance. So let's label these. Okay. We have this big opening called the foramen magnum. Spinal cord comes out there. Let's move it down. We have this is all sphenoid here. All of this, that's sphenoid. This is the roof of your mouth right here. So we got two bones that make that up. One right there and one right here. Let me move that arrow a little bit. Now this is palatine process of the maxilla, and then this is the palatine bone. Okay. So we had this before. You can see this little protrusion here. That's our mastoid process. You got one on either side, right? And then you see the points here, right? Those are styloid processes. Okay. And these are of the temporal bone. Let's zoom in. Okay. So this part of the roof of your mouth is the palatine process of the maxilla. Then the very end of the hard palate is the palatine bone. And then you see I have this block around where you see the sphenoid bone. And then you see this point here. That's the styloid process of the temporal bone. And then this is the mastoid process of the temporal bone. Occipital bone is the bone in the back, and that knot, you can also palpate that knot on the back of your head is external occipital protuberance. Okay, there are a number of holes here, and I'm going to show you a different picture with some of those things color coded. Okay. Let's see what's next. So this is from the inside with the skull cap removed. So this is still part of the ethmoid bone. This is still part of the sphenoid bone. This is part of the temporal bone. Okay. I'm not going to focus on that. Again, there are a number of openings here, and we'll look at other pictures with some color coding on that for that. But there are a couple things I want to look at on this ethmoid and sphenoid. So I'm going to zoom in. So on this ethmoid, you have some depressions here, and here that have holes in them. And then you have a ridge here between those areas. And those are areas we're going to name. Let's put some lines in here. Okay, so the ridge is called the crista galli. And the depressed areas with the holes are the cribriform plate. Okay. And then here, this little depression here on the sphenoid bone, right here, is a depression. The pituitary gland sits in that depression. So the pituitary is totally encircled by bone. That depression is called the sella turcica. think I spelled that wrong. Heliturcica. And we'll come back again to another picture to show you those openings there. Okay. These are a little bit difficult to follow, and I have pipe cleaners going through them, and you can compare this picture with this and this. Okay, so this is the view from underneath, and then this is the view from within after removing the skull cap. And so this is both of those views. So compare them. Okay, so let's just go by our color coding. The foramen rotundum is the one that is brown. It's kind of tucked up under part of the sphenoid bone here. The green one is hard to see. That's the foramen ovale. And then little serum is where it's purple. You can see that better over here. And then the orange is foramen spinosum. And then the jugular foramen is this yellow. And you can see that going through pretty clearly there. Now, the pink over here is the carotid canal. You can see that clearly from the outside, but not so much from the inside. I pushed it through a little bit over here, but it's not super clear on the inside. Sometimes that canal gets super narrow. So that's the carotid canal. Okay. Brown, rotundum. Green is the ovale. The purple is the lacerum. The orange is spinosum. Yellow is jugular. Pink is the carotid canal. Okay. Okay. So here we are looking at some of the axial skeleton. And so cervical vertebrae here, sternum here, clavicle here. Let's scroll down. In here, you can't really get a good, but these are thoracic vertebrae. Then down here will be lumbar. These are the ribs, right? So we had the true ribs. And then we had the false ribs. And then the last two of those are floating ribs. Okay. So we had our sternum, we got the manubrium, the body, the xiphoid process. True ribs, false ribs, and the last two of those are floating. And maybe I'm a little bit too high up for some of them. Let me go back. False, and the last two of those are floating. Okay. Again, clavicle. The whole thing is the sternum. You got the manubrium, the body, the xiphoid process. Then you have the true ribs. And then you have the false ribs, and the last two of those here and here are floating. I think that's all I got on here. Yeah, I got some lumbar vertebrae, thoracic vertebrae, cervical vertebrae. You already know the humerus. Okay. This is the scapula. We looked at it before. This is the anterior side. So this is the acromion. This is the glenoid cavity. This is the coracoid process. There's a depression here above the spine, supraspinatus fossa, and then below infraspinatus fossa. Okay, if those are on your list. Supraspinatus fossa, infraspinatus fossa. So this is the spine here. So supra is above the spine, infra below the spine. You can also tell right or left here. The spine has to point towards the back away from your body. And the glenoid cavity always faces medially. So this would actually be a left scapula. This is the glenoid cavity. That's going to face medially, right? And then this part is always away from your body. The flat part on the other side is against your body. The spine is away from your body. Okay, so this would be a left scapula. See? Okay. This is my pelvic girdle. So we got lumbar vertebrae here. This is the scapula, the sacrum. You can't see the xiphoid processes down there. Ilium, ischium, pubis. This is the pubis symphysis. This is a joint here where these two pubic bones come together, the pubis symphysis. Obturator foramen, the head of the femur sitting in the acetabulum. Greater trochanter here. I don't really see the lesser trochanter here. Iliac crest. Okay. Now, these are different vertebrae. You only need to know C1 and C2 by name. The other ones you need to know what category they fall in. Okay. So, first, let's just start with delineating the three different types: cervical, thoracic, and lumbar. Cervical vertebrae are smaller and they have a smaller body. So this part right here, this is the body. And there are a number of parts to the vertebrae, and we're not going to name all those parts. You need to know the body and the spinous process. Otherwise, we just don't have time. Okay, so the cervical vertebrae have a smaller body, and they also have these little openings on the side, transverse foramen. You don't have to name them, but you need to know the cervical ones are the ones that have those little holes on the side. So they're smaller, and they have the holes on the side. So these are cervical vertebrae. Let's put that on here. Now, the lumbar are the ones that are lower. They're really big and bulky, and they have short, squared off processes. Like the spinous process is short and squared off. This is a lumbar vertebrae. So they are much bigger. See how big that body is? And then the thoracic vertebrae, they have a medium-sized body, and they typically have a long spinous process. That point here is pretty long. So these are thoracic vertebrae. Okay. Now, the two that you need to know are C1 and C2, atlas and axis. The C1 does not have a body. There's no body on this. Okay, you don't see any of this kind of structure. Okay, so this is C1. And then this one, C2, it's the axis. And how do I know that? It does have a body. The body is on the other side. but it has this protrusion right here. This protrusion is called the dens or the odontoid process, and it sticks up. And it's the only vertebrae that has that. No, I'm not spelling that right. No, I was spelling it right. Okay. So you should know the different types. Cervical has those openings on the side, right? And they're small. Thoracic are medium sized with a long spinous process. Lumbar are really big with a big body and short squared off processes. C1 has no body, that is the axis, and the atlas has the dens or the odontoid process, that's C2. Okay, so now for the foot, let's mark some things off. Oh, don't want that. We aren't going to name all of these. So I want you to think about what those are based on your coloring. Okay. So all of these that I've just labeled are tarsals. We aren't going to label all the names of these tarsals here in the middle, but we got two big ones that are easily identified, the talus and the calcaneus. And then we have metatarsals. And then we have phalanges. Now, I'm not sure if on your list we name all of those tarsals. You got the navicular, and then you have the cuneiform, medial, intermediate, lateral, and then you have cuboid. I just think we have so much other stuff to cover. We'll just call those tarsals, but you can identify the talus and the calcaneus. Same thing here with the carpals. They have names, each of them, and you can see them from different views differently. We just don't have time. So I want to get to, I want you to know the important things. So you know they're carpals, and then you got metacarpals, and then you have your phalanges here. And you can name the metacarpals, you can name the phalanges, um, but you want to get to what's important. Okay. So I want you to spend some time going through these. When I post the other lecture, I will repeat some of this stuff, but I want you to spend some time with this. And probably tomorrow early morning, I will um, post the other lecture portions for bone.